Hi, my name is Chelsea in City, and this is my physical assessment for Nursing 170, Section 201. Okay. So I'm going to have my patient come in and sit on the bed. During this time, I will be watching his gait, his hygiene, his skin, anything I can see right off the bat. Come on in. So I'm going to start by doing wipes, which is washing my hands. I'm going to identify myself. Hi, my name is Chelsea. I'm going to be your nurse for today.
Okay.
I'm going to provide privacy by pulling the curtain. And I'm going to kind of give him an idea of what is going to happen with the procedure and maintain safety throughout the entire time. So with this procedure, I'm just going to look over your body head to toe and make sure everything is okay.
Okay.
Okay. Are you comfortable?
Yeah, I'm fine.
Wonderful. I'm going to have you go ahead and lie down. You can take your shoes off. Thank you. Okay. So when he came in, I was looking at his gait. I was assessing his hygiene. He looks pretty clean cut. Shaved. Let's see. So right now I'm going to raise the head of the bed. Normally in a hospital I would have a mechanism that does so. Can you lean forward a little bit? There we go. I'm going to put up the side rail and I'm going to make sure that the bed is locked for safety. I don't see anything else in the room. I don't see any devices attached to him that I may need to stabilize or secure, would be a better word. And then I already have his vital signs, his height, his weight, and I can kind of give a nutritional status from that. I have a better idea of what's going on. So your blood pressure was a little high.
Okay.
Going to document that.
All right.
Are you on medication?
Yes, I'm on 2.
Oh, okay. Were you able to take this today?
Yeah, but I didn't get to take the aspirin.
Okay. You mean, okay. So, I will document that.
Okay.
And I see that your, father-in-law called. I guess that's what you said.
Mm-hmm.
And you guys had a good conversation?
Yeah.
Right before this?
Yeah.
That's what you had said? Okay. So his psychosocial support seems to be pretty sound. And I'm going to assess that throughout this assessment. So, secondly, I'm going to start with the cranial nerve. So the first one is the olfactory. And do you have any problems with smell? Any like phantom smells when you're sitting there?
Nope.
Okay. So cranial nerve number 2 would be optic. I'm going to ask you to read my name tag for me.
Chelsea?
That's what it says?
Mm-hmm.
What else does it say?
Preventing the flu.
Yes, very good. Thank you. So his optic nerve is intact. It is, it's good. So cranial nerve number 3 is ocular motor. So with my pen light, I'm going to assess first his pupil gauge. So if you don't mind, I'm just going to take a look at your pupils. Can you look right at me? They seem to be about a number 2 to 3 on my pen. Somewhere in the middle of 2 and 3 for pupil gauge. And that was the ocular motor. Next one is going to be the light test, which I'm going to... So I'm going to have you look at this pen.
Okay.
Right here. And so look straight ahead. This is, I'm sorry. This is going to shine a light in your eye.
Okay.
Okay, so don't be alarmed. It's only for me to assess your pupil size.
Yeah, no problem.
So look straight ahead at the wall for me, okay? And I'm just gonna look at your eyes. Please keep your eyes open as far as you can. Look straight ahead. Wonderful. I'm gonna do it with the other eye.
All right.
Okay, give your eyes a rest. Blink a little bit. Take a few deep breaths. Good job. So I'm gonna go with your right eye this time around. So keep them open and look at the wall. Ready? Here it goes. I'm gonna do that one more time because you did squint. Wonderful. Okay. So what I assessed was his ability for pupils to constrict. Next, I'm going to do a light test with the ceiling. So I'm going to have you look at this pen.
Okay.
Okay. And then look at that light above me. So sorry. Back of the pen. Look at the light. Pen. And the light. Good job. And both times, or all three times, when he looked at the upper headlight for far away, his pupils had constricted. So trochlear, and abducens. So the next one, I'm going to make an H, and you're going to follow my pen. Good job. Alrighty. So the next thing I'm going to do is cranial nerves number 5 and 7. This is trigmenal or trigeminal and facial reflexes. So I'm going to touch the sides of your face.
Okay.
Okay, and you're going to tell me if you feel the sensation. Okay, so can you feel this?
Yes.
Can you feel that?
Yeah.
Can you feel this?
Yep.
How about that?
Yes.
Wonderful. Okay, so next I'm going to assess his facial symmetry. So I'm just going to step in front of the camera and I'm going to look at your face. Can you give me a big smile? Wonderful. Can you give me a frown? Can you puff out your cheeks? Wonderful. Okay. Can you puff out your cheeks one more time? Okay. Can you frown? No. Let them go. Just normal frown. Can you raise your eyebrows? Okay. You can smile and raise your eyebrows. This is very good. Okay. Good things. So next I'm going to do hearing, and I just want you to tell me if you can hear this.
Mm-hmm.
Can you hear this?
Yes.
Okay. So his auditory works, nerve is seeming to work. Then I have cranial nerves 9, 10, and 12. So I'm going to have you open your mouth and say ah.
Alright.
Okay, so open your mouth. Stick out your tongue, say ah.
Ah.
Okay. So his vagal soft palate did rise. I'm going to have him swallow so I can assess that ability. Can you swallow? Very good. Any discomfort?
No.
Okay. No tension?
No.
Wonderful. Okay. So you're feeling comfortable? You're okay?
Yeah, I'm
wonderful. Good. I know these are quite fun, but we're trying to make it a good time. So next I have spinal accessory, and I'm going to have you shrug your shoulders against my hands. Can you shrug up? Good, very strong. Okay, next I'm going to have him kind of push his hand against, or push his face against my hand. So when you turn, can you push as hard as you can? Good job. Can you do it with the other side, please? Wonderful. Okay. So then I have his tongue, nerve, glossal. I'm going to have you stick out your tongue for me. Wonderful. And you did follow a command, so that's really good. Next, I'm going to give the Glasgow Coma score. So when he came in, his eyes were open. He was alert and oriented, but I'm going to see how much. So can you give me your name one more time?
Frankie Fisher.
Good, wonderful. Can you tell me today's date?
October 19th.
Okay. Can you tell me our location?
Deltec Hospital.
Wonderful. Do you know who the president is?
It would be Biden.
Good. So that means he has a 4 for eye, he gets a 5 for verbal, and a 6 for motor status, because he was able to get up, move, he pushed against my hand, and so that's a total of 15. Next, I'm going to assess his neck and head, next I just did neck and head. Oh no, wait. So I'm gonna do neck and head next. So I'm looking to see if there's any bumps, bruises, scrapes, any abnormalities whatsoever. You did not hit your head today, correct?
No.
Okay, I don't see anything. It looks like you shave often. Do you have any cuts or anything from that? It looks like it's good.
Nope.
So I'm going to check your neck now.
Okay.
I want you to kind of lift your chin a little bit. So I'm going to feel your lymph nodes and see if there's any inflammation, okay? Do you have any discomfort?
Nope.
So your psychosocial needs are being met.
Yeah.
Sorry, my hands are a little cold.
It's okay.
So, next I'm going to assess his eyes. So I did use the light, but let me just make sure that there's nothing in your eyebrows, in your eyelashes. Everything looks good. I don't see any inflammation, no redness, no abnormalities. Your sclera looks clear and white. Irises seem to be symmetrical, no abnormalities whatsoever. And I did check your pupils. The shape of your pupils are the same. There's no difference. So in terms of Perla, I did the pupil check, and he seems okay. He seems good. It's good. Next, I'm going to check his nose, nasal passageways, and pharynx. So go ahead and lift your chin, look up at the sky. It's pink. I don't see any drainage. Do you have any sinus problems?
I do, but I take medicine for it, so no issues. There's
a tiny bit of inflammation. Not much. It could have been drainage from the night before or something like that. Next, I'm going to check his mouth and throat one more time. I did check his throat, but I do need to see if there's, any abnormalities in your gums or sebaceous gland, your glands. Good God. Go ahead, open your mouth. Okay. It's pink. That's good. Stick out your tongue a little bit. Good job. I don't see any thrush. It looks like you brush regularly and floss. Your gums look good. Nothing, no white, no fungus, no nothing like that. And